Anyway, we're taking a break from cooking now to talk a little bit about something really neat that you might not know about. Dr. Michael Broderdorf is the director of the Hyperbaric Wound Care Clinic at St. Elizabeth Hospital in Appleton. Good morning, and thanks for being here.
Good morning, Amy. Pleasure to be here.
You betcha. That's a mouthful. What is hyperbaric oxygen therapy? I think a lot of us have heard of it, but we have no idea what it is.
We fondly refer to it as HBO therapy, and what we do is we take a patient and put them into a hyperbaric chamber, which is a cylindrical chamber, and we dive them. It's like related to like deep sea diving, but we're in 100% oxygen, and we'll take them down to like 3 atmospheres. Right now, we're at 1 atmosphere. It's just, our envelope of air that's pressing down on us, and in the chamber, we'll take them down to 3 atmospheres. And the really neat thing that's happening are a couple of things. Number one, when they're down to depth, we're saturating the body with 100% oxygen, and the blood oxygen content right now is about 80, but in the chamber it goes up to almost 1,800, and what that does is diffuse into the tissues, and where there's a wound, it gets a lot more oxygen so the tissues can survive.
Really?
Number two, what it does is reduce edema. Edema is a bad thing because the more distant the oxygen has to get to the cells. And number three, it works on the white blood cells, and these are the cells in the body that do the ingesting the bacteria. They kill the cells, or they kill the bacteria. And number four, it makes brand new blood vessels, which we call angiogenesis, but these are the small capillaries. So in a wound or an area that doesn't have enough, it makes brand new blood vessels.
Is this something kind of new, this whole therapy?
No, it's been around for 50 years. Really, it's taken off in the last 20 to 30 years.
So what type of patient would benefit from something like this?
Well, right now there's like 13 categories that we can treat, but really at our chamber, we treat maybe 7 or 8, and the most common one are radiation-related injuries. Women that have had breast cancer, have had mastectomies, and later on, because of the radiation, have to come back and have flap reconstruction. And the neat thing about hyperbarics, it reduces edema around the edges and hopefully can salvage that flap. And then they don't need recurrent surgeries.
Now, you also have basically a special wound care clinic at St. Elizabeth Hospital. How does the hyperbaric therapy work with that?
Well, there are a number of wounds that we treat, but one of the bad ones are diabetic foot ulcers, and those are ones that we would treat in the chamber. They're different classifications, but when they get really bad, they get down into the bone, we call osteomyelitis, or bone infection, then it requires 3 things. We'll need to be involved with a surgeon who can debride, get rid of that bad stuff. Number 2 will involve infectious disease, get some really potent antibiotics. And then number 3, we'll use hyperbaric, which will infuse more oxygen into the cells that need it, and hopefully quiet down the infection, and hopefully salvage a limb, if not their life.
We're running out of time, but I want to know what it is like. Walk us through this whole treatment.
Certainly. When the patient gets there in the morning, they'll change into all cotton. We don't need nylon, no synthetics. Into the chamber. It's an acrylic chamber, so they can see they have good visibility. And then one thing they do experience sometimes is they have middle ear issues, and so we'll show them how to clear the ears. I'm sure if you've been on a plane, the popping, creaking sensation, and then we'll slow the dive. And then they can watch TV, they have access to, we have an intercom system, we talk to the patients, and then we bring them back up, and then bring them back up to 1 atmosphere.
How long are they in there?
That's a good question. The dive time is about 90 minutes, but the total time is about 2 hours. It's 15 minutes going down, about 15 minutes going up.
Good results?
Great results.
So if you're sitting there at home and you think this might be something that might help you, how can people find out more information about it?
They can call our department. It's 920-738-2751. That'll get right to our department.
All right, thanks, doctor.
I appreciate it.
Appreciate it.